Slides here. Okay, so some of the objectives for today's presentation, we are going to be talking about what exactly is serious mental illness. We're also going to talk about some of the symptoms and conditions of SMI. We're going to talk about mental health warrants, how to access that information. And we're also going to talk about finding providers and then also some resources in the community if you ever find that you need to get some help for yourself or your loved ones. So, what exactly is serious mental illness? So, a serious mental illness is any mental health disorder that results in functional impairment and that substantially interferes with one's ability to carry out their daily activities. So, what that means is any mental health disorder that can prevent someone, an adult or child, from being able to work, being able to carry on healthy relationships, being able to successfully finish school. And so their mental illness is at such a level that they are just not able to carry out those daily activities. Usually, when we're talking about serious mental illness, we're referring to psychotic disorders, severe mood disorders, so including depression and bipolar disorder. And we're also could be talking about a combination of psychotic and mood symptoms, as well as substance-induced conditions as well. So we have some examples here: schizoaffective disorder, bipolar disorder with psychotic features, and I'm going to go into exactly some examples of those disorders. So, just to give a few stats on the prevalence of mental illness and serious mental illness, just so you have an idea of just kind of how common or not so common it is. So 50% of all lifetime mental illness really begins by about age 14 and 75% by age 24. About 20.6% of US adults experienced mental illness in 2019. So that's any mental illness of any kind. And that resulted in about 51.5 million people and is about 1 in 5 adults. Also, 5.2% of US adults have experienced a serious mental illness. So, those are some of the conditions that I mentioned before. So, some of the psychotic disorders, the severe mood disorders. And that is about 1 in 20 adults, or 13.1 million people in 2019. Also, in terms of youth stats, 16.5% of US youth aged 6 to 17 experienced a mental health disorder in 2016. So that resulted in about 7.7 million people and 1 in 6 US youth. And then about 3.8% of US adults have experienced a co-occurring substance use disorder, as well as mental illness in 2019, which is about 9.5 million people. And just to add that information about co-occurring is that it can be very common sometimes to see some co-occurring substance use with mental illness as well. So these are just some general stats. As you can see, the prevalence of serious mental illness is not as common as, say, mental illness of any kind. So if you have like a moderate depression or moderate anxiety, those conditions are much more common than, say, a serious mental illness. So the psychotic disorders or a severe mood disorders. So we wanted to kind of go just into a little bit of detail about what exactly this serious mental illnesses can look like. So in terms of psychotic disorders, one of the kind of most common types of psychotic disorders is schizophrenia. But we also have a number of other types of psychotic disorders, so including schizoaffective disorder, delusional disorder, and also a substance or medication-induced psychotic disorder. So these are kind of the general types of psychotic disorders. Now, no matter what type that an individual may be diagnosed with, there are certain symptoms that are kind of across the board. You can see either a combination or all of the different types of symptoms that I'll be talking about. So we have in psychotic disorders, an individual can have either positive or negative symptoms or both. So positive symptoms are those particular symptoms that are present in a psychotic individual or individual with a psychotic disorder that is not there in a healthy functioning person. So examples of positive symptoms are delusions and hallucinations. So this is where you're either hearing or seeing things that aren't really there. So those are examples of hallucinations. So they're perception-like experiences that occur without an external stimulus. And they are very vivid, they're very clear. And it's just like, you and I kind of seeing something, or if someone comes into, your office and they're talking to you, that's a perception of reality. When individuals experience hallucinations, it is just as clear and vivid. And they're not under voluntary control. So this is something that happens that these patients are not in control over. Some of the most common types of hallucinations are auditory, which is the most common. That's where someone is hearing something that is not really there. Most commonly, those particular symptoms are voices. Individuals can also experience visual hallucinations, which is the second most common. So that's where someone is seeing something that is not really there. And then you can also have olfactory and tactile hallucinations, which are not as common, but certainly can happen. Olfactory is where someone smells something that's not really there, and tactile is where someone is feeling something, usually on parts of their body that aren't really there. Now, delusions is more a fixed belief that is not amenable to change in light of conflicting evidence. So, even when shown evidence to prove that that particular belief is not true or not real, that person will still hold that belief. The particular delusions can be both bizarre and non-bizarre. So what that means is that sometimes a bizarre delusion can kind of be when someone thinks that someone else has control over their body or their mind. That's usually what a bizarre delusion is. And then all other delusions will fall under kind of that non-bizarre caveat. There are, of course, different types of delusions. Some of the most common types are the persecutory and the grandiose delusions. Persecutory, or sometimes they're called paranoid delusions. That is where someone thinks that someone is after them. Sometimes it could be one person. It can be sometimes the government is a pretty common delusion as well. The government being after them, or tracking their phone, in either tracking like their mic on their phone or tracking their emails. And then also the grandiose delusions are also one of the most common types. That's where someone believes that they have a lot of power, a lot of status. They are kind of put themselves on such a high pedestal, when really those particular beliefs about themselves and their abilities are not rooted in reality. And that's actually something I failed to mention in terms of just psychotic disorders as a whole. These disorders are where an individual has either thoughts, beliefs, or perceptions that are not based in reality. So those are the positive symptoms for psychotic disorders. And then you'll have individuals that will have negative symptoms. Now, negative symptoms are those symptoms or behaviors that you will expect to see in someone. So these are behaviors that you'll see in a healthy, functioning person that are not present in these individuals with psychotic disorders. And so some examples of that is diminished emotional expression. And so we have a term in psychology that we say that an individual present with a flat affect. And what that basically means is that the person will have very little to no emotional expression. So, it doesn't matter what you tell them, good news, or you tell them really bad news, and they'll give you the same very blank, very non emotional expression. Avolition is also one of the most common types of negative symptoms, and that's where someone has very, very little to no motivation. to do anything. It could be getting up and performing their hygiene. It can be kind of going out and meeting new people, or having those relationships, which is also kind of the last one, asociality, where the person has no motivation to be social or to interact with others. And then you'll also see alogia, where the person has very, very reduced or a lack of, we call it poverty of speech sometimes. So they give you very, very short, brief sentences. Even if you're asking them an open ended question, the answers are typically just yes or no. They may even just give you a grunt rather than actually responding to your question. And then, of course, anhedonia is also another type where the person has a complete lack of pleasure. So, lack of ability to feel any kind of pleasure or positive emotion. Disorganized thinking and speech is also a common symptom of individuals with psychotic disorders. Now, the thinking is, of course, very much inferred by their speech. And so, this is where you're talking with the person, and what they're saying is just generally not making any sense. So, when you're having a normal conversation with someone, usually, their thoughts will flow pretty well. Thoughts will connect really well with each other. But when you're speaking sometimes with an individual with a psychotic disorder, they may have very tangential thoughts. So they're kind of shooting off into all directions and concepts of thought. They'll have very loose associations. So the different thoughts are not actually related to each other. And then sometimes they'll have a complete lack of coherence, or sometimes this term that we have, a word salad, where the words that they're saying, none of the words actually connect or make sense. So we call it a word salad because, of course, in a salad, you have all kinds of different ingredients. So you have, the lettuce, you have the tomatoes, the cucumbers. And, when a person has a word salad, it's just kind of all these different things just kind of mashed up into one sentence. And it's not really making a lot of sense. Um, so this particular type of thinking and speaking can substantially impair their communication and really make it difficult to understand what they're saying. And then we can also have substance-induced psychosis, which there are certain substances that can certainly lead to these symptoms. Some of the most common are synthetic marijuana, certainly the hallucinogens, so PCP and LSD, and then also stimulants, so cocaine and amphetamines. Now, interestingly, there are some individuals who will only have short-term effects of these particular symptoms. So the person may only experience psychotic symptoms while they're under the influence of the particular substance. So that would be more of a short-term effect. You can have someone that has kind of a longer term effect. So they're still experiencing the psychotic symptoms even after, they're no longer under the influence. But then at some point, maybe a couple of weeks later, maybe those symptoms will dissipate and cease. And then you can have an individual that will have it will turn into a permanent psychotic disorder. So long after the person is no longer under the influence, the substances are out of their system, they now have a permanent psychotic disorder because of these substances. So that is also something that we see quite a bit because, like I mentioned before, it's not uncommon to see individuals, a co-occurrence between substance use and mental illness. So moving on to the mood disorders, these are also the types of disorders that can fall into that serious mental illness category. So these severe mood disorders, and some examples of them are major depressive disorder, bipolar 1 and bipolar 2 disorder. And then you can have substance or medication induced bipolar and related disorder. So just like the psychotic disorders, I'll kind of just go over some symptoms that can be unique to some of these different disorders. So depression, I think that a lot of people have an idea of what depression looks like. The main thing that makes it a bit different, and so when you're getting into more of that disorder or serious mental illness category, again, is just how much impairment it is causing in the person's life. So there are a whole host of symptoms actually that are involved in depression. One of the symptoms that is unique to no matter what type of depressive disorder you may have is that the person has to have a persistent, sad, anxious, or empty mood. And then, as you can see on the slide here, there are a number of different symptoms that are involved with depression. Depression is really one of those disorders that really creeps into all aspects of a person's life. So it affects, their sleep, their appetite, their energy level. It can affect their thoughts and how they think. It can also affect people physically. So people sometimes will experience aches, pains, or headaches. Um, and then, of course, loss of interest or pleasure in activities. And then some of the, of course, most serious symptoms of depression or symptoms or behaviors would be thoughts or attempts of suicide. Or would be some of the most serious. So these are some different symptoms of depression that no matter how serious a person's disorder can be, you may see a couple or sometimes even almost all of these different symptoms. So mania is a symptom that is involved when an individual has bipolar disorder. So bipolar disorder is, of course, the vacillation between depressive symptoms and manic symptoms. And that cycling happens more so on a pattern of sometimes an individual will be depressed for weeks or months and then cycle into a manic episode or vice versa. So it doesn't happen, kind of minute by minute. It usually the cycle between the two phases definitely happens more of like a week long or months long sometimes. So mania is exactly the opposite of depressive symptoms. So whereas depression, an individual is feeling very low, mania is where an individual is feeling or they have excessively high energy or feeling elated. These are individuals who can go days and days without sleeping and feel like they don't need sleep. They'll have increased energy and activity levels. So, during that time that they're not sleeping, they may, I've had clients, for example, that one time you painted a house in one night when they were in a manic episode. So you're seeing increased activity levels. When they speak, you can notice some racing speech and racing thoughts. They can become easily distracted, and they can also engage in very risky behaviors like very excessive spending habits. And that's whether or not they may have the actual monetary means to do that. And then we also have substance induced mood disorders. And so some of the most common substances are stimulants, PCP, steroids, and synthetic substances. So like bath salts. And so that's common substances to induce mania. And then some common substances in inducing depression can be stimulants, steroids, also some different medications. And these things can also be commonly seen when an individual is withdrawing from drugs. So just like with psychotic disorders, an individual who uses these substances, sometimes they can have a lasting mood disorder. So they can have lasting difficulty with regulating their moods, or they could have, a lasting kind of depressive disorder. We also wanted to talk about post-traumatic stress disorder, as it is, something that not only, of course, happens in our veteran population, but kind of across different traumatic events that can happen in people's lives. Um, so, post-traumatic stress disorder is where a person has exposure to actual or threatened traumatic event. So this way the person is re-experiencing the particular event through what we call intrusion symptoms. So those particular symptoms can be dreams of the event, they can be flashbacks of the event when the person is awake as well. The person also will go to great lengths to avoid reminders of the event. So, whether that's avoiding going to certain areas in the city that may remind them of it, avoiding certain sounds that remind them of the particular trauma as well. They may have some disturbance in their thinking and mood. So, what that can look like is that the person will start to have some different beliefs about the world around them. So, thinking that, people are out to harm them or thinking that everyone is against them. They may start to have more of an irritable mood or a depressed mood as well. These individuals can also have frequent nightmares and they can be have a tendency to be startled easily. So, and that's what we call a hypervigilance as well. So, some associated behaviors could be difficulty regulating their emotions. So, it's not uncommon sometimes to see that an individual can become very easily angered or and quick to become physically aggressive when they feel kind of those reminders of the traumatic event. And also, a lot of times they will have difficulty maintaining stable interpersonal relationships because of that difficulty regulating their emotion, or just constant kind of thoughts or reminders of the trauma and how that affects their behavior. And then we also wanted to talk about developmental disabilities as um, these certainly can be disorders that affect a person's daily life and affects their ability to kind of complete those daily activities. So two developmental disabilities that we wanted to talk about are intellectual disability and autism spectrum disorder. And they're called developmental disabilities because the onset of these particular disorders really will begin in the developmental period. So that is typically from birth to around at least age 5. So intellectual disability, and these also can be a co-occurring kind of diagnoses as well. So you can have someone with autism spectrum disorder who may also have some significant intellectual deficits, intellectual impairment as well. Intellectual disability is significant deficits in intellectual and adaptive functioning. And we really look for those deficits in the conceptual, the social, and the practical domain. So the conceptual domain are those particular abilities. That were typically known as kind of school type of activities. So reading, writing, reasoning, math skills, those kind of things. The social domain is, of course, connecting, making connections with others. And then the practical domain are those everyday activities that someone needs to function. So being able to get up and do your hygiene, make meals for yourself, and of course, developmentally appropriate to the person's age. The intellectual functioning must be measured through clinical assessment and standardized intellectual testing. And as I mentioned, of course, the onset of the deficits must be during the developmental period. Autism spectrum disorder affects an individual's communication and behavior. So these are individuals that have difficulty with communicating and interacting with others. They may have some restricted interests and repetitive behavior, and they also typically have a very difficult time adjusting to changes in their routine or their schedule, and it impacts their ability to function in various life areas. So, When you have a child, for example, with autism spectrum disorder, some of the most extreme types of symptoms or behaviors we can see is kind of head banging when they're frustrated. Sometimes during play, they have very restricted or fixed types of play. So you'll see some children sometimes lining up certain toys a lot, or if they are, have a certain activity that they like to do or play, they'll do the activity in the same exact way every time. And so those are just some examples of children with autism spectrum disorder. And as the name suggests, it is a spectrum. So there's a wide variation in the type and the severity of symptoms. So there are individuals who have autism who are completely nonverbal, and they need assistance with every single activity in their lives. And then there are individuals, who are verbal. They are able to understand some nonverbal behavior, but there's still that difficulty with communication and interaction with others. Um, and so technically, we no longer have Asperger's disorder in the DSM, which is our manual that we use to diagnose. That's the Diagnostic and Statistical Manual of Mental Disorders. But those particular behaviors and symptoms that have been associated with Asperger's are included, of course, under autism spectrum disorder. So someone who maybe previously had a diagnosis of Asperger's disorder, now it is coded as an autism spectrum disorder, and just their different abilities or deficits are noted with that. So now we're going to move on to kind of some of the resources that you can access here in Fort Bend County and in Houston. And Dr. Todaro is going to focus on that.
Thank you, Dr. Martin. So like Dr. Martin mentioned, I'm Dr. Danielle Todaro, licensed psychologist with Fort Bend County Behavioral Health Services. And I'm going to speak a little bit about now some resources, accessing treatment, accessing services for loved ones, family, friends, neighbors who might be experiencing one of the serious mental health conditions that Dr. Martin covered, and kind of how to connect them to services and resources. So the first area that I wanted to talk about was mental health warrants. So mental health warrants are a way to facilitate somebody that's in immediate crisis getting into inpatient psychiatric care. Now, it's important to keep in mind that if we have somebody in our lives that may be experiencing a crisis, a mental health crisis, and they are voluntarily willing to go to the hospital, then there's no need to seek out this type of warrant. If we can get somebody to agree to go into treatment, then we can just secure them a bed at a facility, which I'll talk a little bit more about in a few minutes, and they can voluntarily come into treatment. Unfortunately, when folks with serious mental health disorders are in crisis, a lot of the times they're not willing to voluntarily go for treatment, and so we may need to exercise getting a mental health warrant in order to get them into those services. So basically what this does is it authorizes law enforcement to take a person into their custody to get them evaluated by a doctor, by an appropriate mental health provider, to determine if they need to be hospitalized. So it's not a warrant for arrest. These folks are not getting taken into jail or incarcerated, but law enforcement will assist in, getting them safe and then potentially transporting them to a local hospital for treatment. So it is a way to assist in getting the person who's unwilling to go to treatment. So the requirements are that the individual who is in crisis, the potential patient, must either reside in Fort Bend County or currently be in Fort Bend County. And what will need to be shown or provided is current information that that individual is suffering from a mental illness, so perhaps one of the disorders that Dr. Martin just mentioned, and that they are in immediate danger to themselves and or others. The difficult thing about a mental health warrant is that past behavior may not necessarily be sufficient to secure such a warrant. So if the individual was in crisis a week ago, but currently is not, then it may be difficult to secure this type of warrant. The person really needs to be in immediate crisis, in immediate danger. It's also not possible to secure a mental health warrant for somebody who is currently in jail for a violent offense. So a person has to be out in the community in order for this type of mental health warrant to be issued to get them into treatment. There is a mechanism if you do have a loved one that is currently in jail and experiencing serious mental health issues that require hospitalization. There are mechanisms to get those folks there, but that's a different set of circumstances. So if the individual is out in the community, this is the way to proceed. If the potential patient, the loved one, the family member, is a person that has health insurance, then what you or another family member, another loved one can do is locate a facility in the area, a psychiatric facility that will accept the patient, accept their insurance, and accept them into the facility because they have space. They have a bed available for that individual. It's important when you are calling facilities and you find some place to get the name of the facility, the number for their admissions department, because you will need that later on when filling out the actual application for the mental health warrant. Now, if the facility happens to be in Harris County or any other county, Harris County will likely be the one who will be issuing the mental health warrant. And so you may need to get in touch with the Harris County attorney's office in order to file that paperwork. The county attorney's office has a lot of information on their website. I'll have the link in another slide or two in terms of getting a mental health warrant issued. So just keep that in mind, that another county may have to do it if the hospital is in that area. If the individual that's in crisis does not have insurance, you may call facilities, call local hospitals, and try to locate what's called an indigent bed for that individual. So basically, hospitals will have a certain number of beds where they can serve individuals that are uninsured. And so if you can find a facility that is able to take them, then you would follow through with the same process of getting the hospital's information and using that when you fill out the application. If no private facility will accept the patient that is uninsured, then you can also reach out to Texana Center, which is our local mental health authority. I'll be talking about them a little bit more in a few minutes, and they may be able to assist in the process. Texana Center does have its own crisis center, which is, a kind of a small inpatient facility where folks can go. So it's possible that there may be a bed or space available at that facility. You can also seek out beds at state hospitals. So these are hospitals that are funded through the Department of State Health Services. Unfortunately, there are no state hospitals in the immediate Houston area. They're all in outside areas. So again, if you are able to secure a bed at a state hospital, you may have to go through the county attorney's office in that particular county where that hospital is located. So how do I file for a mental health warrant in Fort Bend County? So you will need to contact the justice of the peace for the precinct where that individual, that proposed patient, lives or is currently staying. And you will want to call them ahead of time and let them know that you're coming in to complete an application for a mental health warrant. I've listed here all of the justices of the peace across Fort Bend County. So it would be advised to call the one that's closest to whatever area the proposed patient, the individual in crisis, is located in to see if they are the correct location where the warrant should be filed. Again, if the bed is secured in another county, it would be advised to talk to the JP, the individuals at the JP court to find out if they are able to facilitate it or if you need to go through, say, Harris County or another local county in order to facilitate the warrant. So if crisis happens after business hours or on the weekends, which of course is always possible, you won't be able to get in direct contact with somebody at the Justice of the Peace. So you can call the Sheriff's Office dispatch at this number provided and let them know that you need to make contact with the Justice of the Peace on call regarding a mental health warrant. And they should be able to direct you and advise you in how to make contact with that individual. So once the application is completed, it's been reviewed, and a mental health warrant is issued, then it will be sent to either the sheriff's office or possibly Texana Center, then to coordinate how to make contact with the individual in crisis and then transport them to whatever facility has been located that has an available bed for the person to get assessed and hopefully admitted to for treatment. Like I said, the county attorney's office has an abundance of information about mental health warrants, securing warrants, answers a lot of questions. And so on the previous slide, there's a link at the bottom to the Fort Bend County Attorney's Office. Thank you. That link at the bottom, and it has, like I said, a wealth of information about mental health warrants. And again, if your loved one or family member or friend is in another county, in another area, you can always reach out to the county attorney's office in that jurisdiction to find out what their process is like. So we are very lucky within Fort Bend County to have our crisis intervention or CIT team embedded as part of our sheriff's office, and they are a critical piece in terms of providing assistance, support for individuals with serious mental illness who also may find themselves in crisis. So this is a specialized unit within the sheriff's office that's funded under some federal grants and assists with helping individuals who have a serious mental illness who also may be in crisis at the time. So their goal is really to reach out to these individuals and connect them with appropriate services, and many times divert them either away from incarceration, if the person is in crisis and perhaps there may have been some kind of violation of the law that was committed in the course of their crisis, the CIT team can really help intervene and potentially divert that person away from jail, at least, temporarily, into a psychiatric facility to get stabilized and to receive treatment. They are also there to help divert folks that are in mental health crisis away from emergency rooms, where oftentimes they may end up seeking care, but really they may need to be at a psychiatric facility instead. And especially right now with COVID and the pandemic, we want to keep our emergency rooms open and available for medical emergencies. And so CIT can assist in getting somebody in a psychiatric emergency to the appropriate psychiatric facility. Right now, the CIT team has about 10 members. Hopefully that will grow in the future in order to be able to assist as many residents of the county as possible. And the unique thing about the CIT deputies is that they have very specialized training to know how to de-escalate crisis situations and to, like I said, assist in diverting individuals into appropriate care and crisis services. CIT also helps to provide a lot of training and education about mental illness and working with individuals in crisis and working with individuals with mental illnesses and developmental disabilities to other first responders in the county and really all around the area. So they provide trainings to other law enforcement agencies, fire departments, emergency medical services, so that they can also be trained in how to manage crisis situations. But of course, CIT can always be contacted and if available, can respond to any kind of crisis situation. So Texana Center, I've mentioned them a little bit already. They are the local mental health authority here in Fort Bend County, and they also serve several other local surrounding counties. So across Texas, there is a community mental health provider in all areas and all regions that provides a variety of outpatient services, sometimes inpatient. Like I mentioned, Texana does have a crisis unit. To folks that may be insured, may be underinsured, or may be uninsured. And they will provide services regardless, like I said, of insurance or citizenship status. They provide behavioral health care, so obviously treatment for those with serious mental health conditions, as well as services for folks with intellectual disabilities or developmental disabilities. They work with children all the way through adults. Dr. Martin had talked about autism spectrum disorder. Texana can also provide treatment services to those individuals as well. And services vary across, individuals' different needs, whether it's case management, counseling, medications. They provide a variety of different services across both the behavioral and developmental disabilities. For veterans that may experience serious mental illness, so of course, Dr. Martin mentioned PTSD, but we also have many veterans who may also be experiencing a mood disorder or psychotic disorder. There is a local agency called the Xena Project. They are a public charity, and they provide a variety of different services to veterans. So if you have a loved one, family member, friend who is a veteran, the program does not have any kind of requirements in terms of what branch of the military they may have served in or are currently in. They can be active duty, veteran. They don't have to meet any kind of disability requirement in order to receive services. And the Xena Project is run by veterans, so it's a great place to connect veterans who may be also experiencing some mental health issues to other people who have been through similar experiences. They offer group and individual sessions, family reunification. They do a lot of animal therapy, primarily with horses, which has been shown to be highly effective, especially in individuals who suffer from PTSD. So they are a great local resources for veterans who are seeking out some veteran-specific services. So we wanted to provide a little bit of information about the different types of providers that are out there. So if you may be experiencing a mental health condition or have a loved one who maybe was recently diagnosed, it can be very overwhelming when trying to find a provider because there are there's a very wide range of mental health providers out there, and they all kind of have unique areas of specialization. So we just wanted to provide some extra information about that. So psychiatrists, so these are mental health professionals who hold a medical degree, and their primary focus in terms of mental health services is providing medication. So they will assess patients, prescribe medications. They'll be responsible for monitoring those medications, changing dosages, changing to different types of medications in terms of the person's mental health care. Sometimes they can provide a bit of counseling services, but very traditionally, we think of psychiatrists as the medication component of treatment. And then we have psychologists who hold a doctoral level degree, so either a PhD or something called a PsyD. And these individuals can provide various different services, including counseling, so individual counseling, family, couples, group counseling, and also can do psychological evaluations. So evaluations where they're meeting with folks, gathering their clinical history, maybe administering different tests and assessments, and then can formulate a diagnosis for an individual and provide some recommendations for treatment. So psychologists can be utilized in both of those capacities. And then we have professional counselors in Texas. They're called LPC, a licensed professional counselor. These are individuals who have a master's degree, and primarily their focus is delivering counseling, therapy, again, individually, groups, families, couples, And that's their primary focus. And so when somebody has a serious mental health disorder, they may be seeing multiple different providers. So they may have a psychiatrist that they see for medications, and then maybe a psychologist or a counselor that they're seeing for, therapeutic services. Perhaps also case managers, social workers. So there could be a large number of people on a team treating somebody with a serious mental illness. The most important thing to remember is that whatever type of provider you're seeking, just to ensure that that person has the appropriate license to practice in that area here in the state of Texas. So in terms of accessing private providers, so if your family member, friend, neighbor that you are trying to help connect has insurance, then the best place to start would be through their insurance provider. And there they can see all the different types of mental health professionals that we just discussed that are on their plan that take their insurance. You can also seek out to some local associations, so the Texas Psychological Association or the Texas Counseling Association. Those are statewide associations for psychologists and for professional counselors. If you access their websites, they have search capabilities on there to seek out clinicians in those various professions in your area. Houston Psychological Association is obviously a more local association where you can find psychologists in the Houston area. And then Psychology Today is a great resource. It's a website that you can search providers, throughout the country, really. So you could search throughout Texas, say you had a loved one that lived in a different area of the state, and you can even refine your search to see particular services that are provided. So if you're looking for somebody that specializes in working with folks with bipolar disorder, for example, you can see the insurances that they take, and you can even filter down more specifically if somebody's looking for a male clinician, if somebody's looking for a Spanish-speaking clinician, if you need a counselor that works with LGBTQ plus issues, you can really whittle down your search to find the right provider for your specific needs. And then here we've included just a list. It's not an exhaustive list of some local and state psychiatric hospitals. So, I know for families, if it's never happened before and you are seeking out a mental health warrant, it could be very overwhelming to try to figure out hospitals to call. So this is a list of, like I said, some of the local hospitals. None of these are, particularly endorsed by us at Behavioral Health Services. We worked with individuals from all of these different facilities, but this is just a resource in terms of places to maybe start calling and looking if you do need to secure a bed for a loved one for a mental health warrant, or if somebody is willing to go voluntarily for treatment as well. And then in addition, a lot of the local hospitals, so none of the state hospitals, but a lot of the local hospitals also provide other treatment programs that don't necessarily include full inpatient hospitalization. So a lot of facilities have what are called partial hospitalization programs, where folks may spend a little bit of time in the hospital and then have some outpatient services. Or there are intensive outpatient programs, which are, just as the name implies, they're very intense treatments that are provided on an outpatient basis that a lot of the hospitals offer. Some may require that you have had an inpatient stay there in order to access those services. Others may not. So it's, a good resource to reach out if you're looking for different types of treatment options. And just for informational purposes, West Park Springs, the last hospital on this list, is actually the only one currently that's located in Fort Bend County. All the others are in Houston, or of course, some of the state hospitals, you can see where they're located. They're in the surrounding Houston adjacent area. And then in terms of other resources, so other crisis resources. So again, if you have a loved one that is in crisis, Texana does have a crisis line that you can reach out to them directly, and they can make contact with the individual, possibly come out to where the individual is to assess if there is a need for hospitalization due to crisis. So the mental health warrant is one avenue to potentially facilitate somebody going into the hospital, but Texana crisis line could be another option. Again, we talked about the CIT, the crisis intervention team. So if it's a non-emergency situation, maybe you're worried about a loved one, you know, want CIT to go out there and make contact, make sure they're doing okay, you can contact this non-emergency dispatch number and ask for a CIT officer. Of course, if there's an emergency, if somebody is in immediate danger of harming themselves or harming someone else, 911 is of course the resource. And when you call 911, you can ask, you can request CIT. I think that's a really critical piece. You know, unfortunately, we may not have the resources to cover every, you know, single crisis in Fort Bend County, but CIT, it makes themselves as available as possible. So if there is a psychiatric crisis and 911 is the resource that you need to utilize, you can ask for CIT, and they may be there in addition to, you know, a regular deputy from the sheriff's office, but you can always ask for them if available. Harris Center also has a crisis line. So the parent agency to Texana, which is our local mental health authority, is the Harris Center in Harris County. So if your loved one is living in that county, you can contact that number. You have to press 1 in order to access the crisis line, because that's also the general number for Harris County if you just need to call to access any other services. There's a veterans crisis line. Again, if the person that's in crisis is a veteran, they can contact that phone number. There's also a text number, which some people might feel more comfortable with that. And then, of course, the National Suicide Prevention Lifeline, that's a national crisis number that can be accessed. And then here locally, Memorial Hermann has 3 crisis clinics, one in Spring Branch, one in Maryland, one in Humble. So unfortunately, none of them are very close to Fort Bend County, but they're an excellent resource as well for folks in crisis to come in. They can get an assessment. They may be able to obtain medications right then and there, and then be connected to ongoing long-term services as well. And then again, some other additional mental health sources, not necessarily for folks that are in crisis, but folks that might be experiencing serious mental health condition, to reach out for more information. So of course, Fort Bend County Behavioral Health Services, we are here to assist in any way possible with connecting folks with resources in the community. So our number is listed there. That's our main office number. Again, Texana Center. So this is the non-crisis number if you are interested in getting more information about potentially having your loved one connected with any of their outpatient services. The Harris Center, also their number as well if your loved one is in Harris County. And again, keep in mind that Texana serves several other adjacent counties here. So if you have a loved one that lives in Morton County, for example, you'd still want to make contact with Texana Center for them. Access Health is a great resource here in Fort Bend County. They have, I think, 3 clinics, I believe, around the county, and they do provide some behavioral health services. So the number for them is there, and they're a great resource to reach out to, especially for folks that may be underinsured or uninsured. NAMI, the National Alliance for Mental Illness, the Greater Houston area has a chapter, and they provide a wealth of information, education on mental health conditions. And then the Veterans Administration, of course, we talked about veterans can experience a variety of serious mental health conditions. I've listed the main number for the DeBakey, the main VA hospital in Houston. And then there's also a Richmond clinic that does provide some behavioral health treatment as well. It's obviously located in Fort Bend County, and their number is there. And then lastly, contact information for both myself and Dr. Martin over at Fort Bend County Behavioral Health Services, where we provide a lot of different services to individuals who are involved in the court system, at risk of involvement in the court system, but as I mentioned, can also connect folks that may not be in the court system. We can definitely connect folks with other resources and provide other avenues for them to seek out treatment. So I don't know if there are any questions that have come in, but we have a few minutes to address any questions that there might be.
I don't see, hi, sorry, can only see the top of my head. That was a great presentation and great resources. So I really appreciate Dr. Martin and Dr. Tadara taking the time. Things have been a little busy to talk about this. So I don't see any questions, but these presentations are available on our website. I think they're also available on the county website. There's actually a YouTube link that IT takes care of. It makes, we have a great IT department that has supported this. So great resources, knowing about mental illness, what to look for, and then knowing what resources are out there and trying to get individuals connected as quickly as possible with the right resources, really critical. So feel free to share the link with others. I know folks are busy, but if this is good information, make sure you share it with your department, with your staff, and then friends, family members. And again, as Dr. Martin and Dr. Tadaro said, we're here to help. So we are very fortunate in Fort Bend County. We have a lot of resources. We have an amazing crisis intervention team. We also have a behavioral health services department, which is a little unique. We work very closely with our justice partners, including the courts and the jail. But we also work very closely with our health department and several of the providers in the system. So we can be a resource, not only if you have a loved one that's involved in our criminal justice system, but if you need help, we can usually connect you to resources and provide you some information. We have several licensed psychologists on board, so we're here to assist. So I don't think there are any questions, but I just wanted to personally thank Dr. Martin and Dr. Tadaro just for the work that they do every day and for taking the time to do this presentation and to share this information. Thank you.
Absolutely. Thank you. Glad we could do it and kind of share this information.
Thanks.
Yes, thank you very much.